Okay.
Good evening, everyone. Let us begin today's session with Omkaram. Let us now follow with the NMO mantra. न त्वहं कामये राज्यं न स्वर्गं न पुनर्भवं कामये दुःखतप्तानां प्राणिनामूर्तिनाशनम्. A warm and heartfelt welcome to all the participants of NMO AP's Med-Katalyst Foundation program for first year revision series. Today, we have an interesting session on physiology by Dr. Sarvani ma'am. It is our privilege to have Dr. Sarvani ma'am from SVIMS, Padmavati Medical College with us today. We sincerely thank you for graciously accepting our invitation, ma'am. With great respect, I now request Dr. Sarvani ma'am to kindly take over the session and guide us with her valuable insights. Thank you, ma'am.
Okay. Good evening, all. Am I audible, ma? Can I make my screen little larger?
Ma'am, you're audible, ma'am. Screen అర్థం కాలేదు, ma'am.
స్క్రీన్ అంటే నీది హాఫ్ వస్తుంది కదా, అదేమన్నా మార్చడానికి
లేదనుకుంటా, మ్యామ్.
ఓకే, నో ప్రాబ్లం. జస్ట్ ఉందే అడిగాను, నథింగ్ టు వరీ.
ఓకే
ఓకే. గుడ్ ఈవినింగ్ ఎవ్రీవన్. Okay. So I know you're all very much overwhelmed with preparation and everything. Around 17 days more, 16 days, I think. Okay. First of all, I would like to say all the best. And the topics given me are of very, very important topics. That is oxyhemoglobin dissociation curve and cardiac cycle, conducting system of the heart, as well as erythropoiesis and all these things. So what I want to do is, actually, I don't want to go into the ABCDs of each and everything, but I would like to ask you some questions. Let it be little interactive. And I think when I want to conduct a rebriefing session, I want to tell you few things. One is how to present your answer. All of you might have gone through what is oxyhemoglobin dissociation curve. Okay, so here, how to construct this particular, I will share my slide with you. Just a minute. Is it visible, Amma? Please answer.
Yes, ma'am. Yes, ma'am.
Okay, that's fine. So in oxyhemoglobin dissociation curve, all of you know that there are two types of transport of oxygen to occur. One is dissolved form and another one is in the combination with that of the hemoglobin. So this particular diagram, when you are constructing, try to keep your 4 points, you take it as landmarks for you. That is 27. Can anybody tell what is P50 and how this P50? Anybody? Let it be interactive, ma, please. I don't even know anybody is there on the other side or not. No problem if you do mistakes also, nothing to worry. P50 is the one of the most important landmark on this particular oxyhemoglobin dissociation curve. That is one of the that is 50% saturation of oxygen when the oxygen tension or partial pressure of oxygen being 27 millimeters of mercury pressure, P50. Okay, and another point is you try to take it as 75% saturation, 50% saturation at 27, 75% saturation at 40 millimeters of mercury pressure, and around 90% saturation at 60 millimeters of mercury pressure. These 3 points you make it and try to connect this particular way. You can do a better represent a better diagram or better graph. Okay, and one more thing is the unloading zone, loading zone. This is happening at the lungs. I think all of you know this one. And this unloading zone, this is happening at the tissues. Okay, and what are all the changes if the right shift occurs? What are all the what do you understand this? Do you think the oxyhemoglobin the hemoglobin affinity towards this oxygen is increasing or decreasing? Oh my god, I'm speaking to a wall.
మ్యామ్ సారీ మ్యామ్, బేసిక్ గా అటెండీస్ కి మైక్ అలవెన్స్ ఉంటుంది మ్యామ్. చాట్ బాక్స్ లో చెప్తున్నారు మ్యామ్. మీకు చాట్ బాక్స్ విజిబుల్ ఉందా మ్యామ్?
ఓకే, ఒక్క నిమిషం, ఐ విల్ ఓపెన్ దట్ వన్ దెన్. జస్ట్ గెట్ ఒక్క నిమిషం మా.
పోనీ చాట్ బాక్స్ లో నేను మీకు చెప్పనా మ్యామ్? ఇట్ విల్ బి ఈజియర్ మీకు బ్యాక్ అండ్ ఫ్రంట్ వెళ్ళకుండా.
బెస్ట్ అమ్మా, బెస్ట్. యు డు దట్ వన్.
యా మ్యామ్, ఇంక్రీజ్ ఇన్ PCO2 అని చెప్పారు మ్యామ్.
Increase in PCO2 is the reason for Amma. Is it visible now to you? Graph
Yeah,
is
ma'am.
okay.
Yeah, ma'am.
That's fine. So here what I asked is what is going to happen to the affinity towards oxygen of the hemoglobin when shifts to right? Is it increased affinity or decreased affinity? That is my question.
Decreased affinity అని చెప్తున్నారు మ్యామ్.
Amma?
Decreased affinity అని చెప్తున్నారు మ్యామ్.
So decreased affinity. So what are all the factors which are decreasing the affinity? Is one of the thing you told is already increase in PCO2.
Yes ma'am. Yes ma'am.
Yes. So what are all the other factors which influence or shift the curve to right? Is one is of course increase in pH level, and another one is increase in carbon dioxide, increase in temperature, and as well as increase in 2,3 DKG. Can anybody tell what are all the physiological conditions in which all these things are going to be observed and which decreases the affinity towards oxygen and release, more and more release occurs? Anybody ma? Any answer, Siri?
No ma'am. Ma'am, respiratory acidosis అని చెప్పారు మ్యామ్.
No ma. Respiratory acidosis, only pH is going to be decreased, not all the factors. Simple and routine experience is exercise. Exercise where CO2, PCO2 levels increases, pH levels are going to be decreased, and temperature is going to be increased, 2-3 degrees levels are going to be increased. This is one of the physiological condition where the shift to right occurs. Please all of you make a note of it. Okay. Now we will try to understand when the curve shifts to left side. So left side means it is more affinity. It is having more affinity, and usually one of the, can anybody tell when it shifts to left? Answer.
మ్యామ్ సేమ్ మ్యామ్ కండిషన్స్ చెప్తున్నారు మ్యామ్.
Okay, decreased. Okay, opposite conditions.
యా మ్యామ్.
Okay. Is it in adults or fetal conditions? Anybody? So I'll tell you that is
ఫీటస్ అని చెప్పారు మ్యామ్.
Amma?
ఫీటల్ కండిషన్స్ అని చెప్పారు మ్యామ్.
It's very good. Hemoglobin F. Hemoglobin F has more affinity because of its configuration, and it is going to be more helpful for the fetus to sustain in the hypoxic states. Okay, this is one thing how to construct. I told you what are the factors and what are the physiological conditions in both the cases, shift to right, shift to left, and okay, we will move on to the next one. That is Bohr's effect. What is Bohr's effect? Anybody? Whenever there is H plus ion concentration increases, the curve shifts to right, and this is called Bohr's effect. And now we will move on to the next topic, that is, okay, before going to that one, just a minute. Now I will ask some questions, Ma. Why the curve is sigmoid shaped? Why not it is in straight line? Anybody, please? These are all reasoning questions. They will ask in 3 marks questions. I think all of you know. Any answer?
Not yet, ma'am.
Okay, please all of you make a note. Oxyhemoglobin dissociation curve is sigmoid in shape because heme interaction are cooperative binding kinetics. Please all of you make a note. I'll repeat again. Heme interaction are cooperative binding kinetics. What is the meaning of it? That is, all of you know that there are 4 heme molecules are there in the hemoglobin, and it is going to attach with that of the 4 molecules of oxygen. But it is not happening at the same time. Simultaneously, all 4 molecules will not go and attach. But what is going to happen is, one is going to be attached, and then the tense form is going to be converted into slowly relaxed form, and T form in the deoxygenated form. Please all of you make a note, deoxygenated form. T form, that is tense form, where it has less affinity to accept oxygen or less acceptance towards oxygen. So, but when one molecule of oxygen goes and binds with the one heme molecule, it will be more showing little more affinity towards the oxygen, and one more it is going to, when in stepwise fashion, when it is going to accept one after the other, it is going to be more and more. That's why it is sigmoid in shape, and this process is called as heme interaction or cooperative binding kinetics. Okay. One more question is, why is carbon monoxide poisoning is dangerous even when PO2 is normal? Anybody?
More affinity and చెప్తున్నారు మ్యామ్. Hemoglobin has more affinity for carbon
monoxide. Okay, very good. Here you have to understand one aspect, that is oxygen is carried in 2 forms. One is dissolved form, another one is combination with the hemoglobin. That is nothing but we discussed ODC curve. So PaO2 being normal in this condition, ikkada case or reasoning lo em ichcharante, why is carbon monoxide poisoning is dangerous when PaO2 is normal? PaO2 is normal means that is dissolved oxygen is normal. Dissolved oxygen levels are normal, but carbon monoxide is more affinity. How many times it is more affinity? Anybody?
మ్యామ్ ఒక్కరు 200 అన్నారు మ్యామ్.
Yes, 200 to 220 times. Okay, so when it is going to okay, one of you please tell me, when carbon monoxide combines with the hemoglobin, does it moves or shifts towards right or left?
రైట్ అన్నారు మ్యామ్.
Wrong, ma. That is not correct answer. It shifts to left. No oxygen is going to be relieved from this particular thing, released. Okay. Anybody in now? I think many people can answer this one. Why does fever improve oxygen delivery to the tissues?
Temperature.
Very good, very good. When the temperature increases, shifts to right occurs, and right shift means more and more release. One question for all of you. That is P50 is going to be increased in exercise. Is it correct statement or true or false? P50 is increased in exercise. All right. True or false?
True antunar, ma'am.
Very good. Right answer, ma'am. Same, one more question on P50. An increase in P50 indicates decrease in oxygen affinity or increase in oxygen affinity. Anybody?
Decrease annar, ma'am.
Very good, right answer. One question for you. That is, okay, almost repeat questions, just a minute. Okay. Now shall we move on to the next topic? That
Yes, ma'am.
is cardiac cycle. Okay. I don't know to which extent the diagram is good for you. I think all of you are able to see. Can anybody define cardiac cycle and what is its normal value?
Ma'am, duration okkati chepparu, ma'am. 0.8 seconds.
Okay, the events happening from one heartbeat to another heartbeat. What are all the different types? That's correct answer, Amma. 0.8 seconds when the heart rate is 75 beats per minute. Okay, we will move on to that. So, what are all the events? It is only mechanical events, electrical events, or heart sounds, or pressure volume changes. It is not any one of it, but all together. That is electrical, mechanical, pressure volume changes, and heart sounds all together we are going to discuss and describe in the case of cardiac cycle. And of course, Figures diagram is the one which helps you to understand all the different aspects of the cardiac cycle. Okay, now any one of you please tell me, if a person is with tachycardia around 180 beats per minute, 180 beats per minute. So, do you think any problem with the filling of the heart, any issues are going to be there? First question is, any issues are there? Second question is, what is going to happen to the cardiac cycle duration?
Diastole taggutundani cheptunnaru, ma'am.
Emma? What is
diastole duration taggutundani cheptunnaru.
Very good. Maximum compromise occurs whenever there is increase in heart rate. Cardiac cycle duration decreases, and especially this particular diastolic phase is going to be decreased. How many of you accept the diastolic phase is very important? Yes or no? So if you see the division, 0.3 seconds are for the systole and 0.5 seconds are for the diastole in the case of ventricle. Okay, ventricular event. So more amount of time the ventricle spends in the diastolic phase. Filling is more important for pumping action. So ఇక్కడ up to 180 beats per minute, usually filling is not going to be that much compromised, even though diastolic duration is going to be decreased. Beyond that one, much compromise in the filling phase occurs, and of course, then further pumping occurs. Okay, any one of you please let me know To which extent atrial contraction contributes for filling of ventricles? To understand atrial contraction, how much percentage of contribution by the atrial contraction to fill the ventricle?
30% అన్నారు మ్యామ్ 30% అన్నారు మ్యామ్.
Yes, 20 to 30%. 20 to 30%. Okay. Isovolumic contraction corresponds to which heart sound? Isovolumetric contraction corresponds to which heart sound?
S1 అన్నారు మ్యామ్.
Yes, heart sound 1. Okay. Isovolumetric contraction corresponds to dash wave of JVP.
QRS కాంప్లెక్స్ అన్నారు మ్యామ్.
JVP ra. I'm not talking about VC.
ఓకే మ్యామ్, సారీ మ్యామ్. పీ వేవ్ అన్నారు. పీ కట్టింది మ్యామ్. సారీ మ్యామ్, ఇంకా ఏం ఆన్సర్ రాలేదు మ్యామ్.
Just let us give some time for that.
ఓకే మ్యామ్.
JVP. In JVP, isovolumetric contraction corresponds to dash wave of JVP. All of you please go back and check the waves of JVP. Okay. 5 waves will be there. 3 positive, 2 negative waves. You try to find out what is the reason for A wave is atrial contraction. Isovolumetric contraction is the reason for C wave. Please, all of you go through it again. JVP is very important. Can you tell what is the pressure in the left ventricle during the rapid ejection phase? In the rapid ejection phase, pressure in the left ventricle as well as pressure in the right ventricle. Anybody?
120 అన్నారు మ్యామ్.
120 in left ventricle. Very good. Right answer. Anybody can tell what is in the right ventricle?
25 అన్నారు మ్యామ్.
Very good. 25 millimeters of mercury pressure, and you should able to understand the difference. The side by side chambers are going to show a variation, maximum variation in the peak of the ejection phase. That is 120 millimeters in the case of left ventricle, 25 millimeters in the case of right ventricle. Anybody can tell what is the reason why the pressure generated in the left ventricle is much more than right ventricle?
హయ్యర్ అయోటిక్ రెసిస్టెన్స్ అన్నారు మ్యామ్.
Very good. Peripheral resistance is much more, and whereas pulmonary circulation is with the low resistance, low pressure, low resistance system. Okay, now we will move on to the next. Okay, just a minute. Okay, shall we move on to the next topic? So, in the case of cardiac cycle, of course, definition of cardiac cycle, I told you that is all the events are included, one heartbeat to another heartbeat. The cardiac cycle duration is from one heartbeat to another heartbeat, and it is about 0.8 seconds. And atrial events, ventricular events, atrial events are 0.1 second of atrial systole, 0.7 seconds of atrial diastole, and ventricular systole is about 0.3 seconds. Ventricular diastole is about 0.5 seconds. Okay. So, and whenever cardiac cycle is asked as an essay question, there is no doubt you have to write in detail about the Vickers diagram. You try to put the definition, keep definition, normal values, and the events, atrial events, ventricular events, as well as another thing is Vickers diagram. Vickers diagram is with the pressure changes in the left ventricle, pressure changes in the aorta, pressure volume changes in the left ventricle, and please that is ECG waves as well as heart sounds. Okay, these are all the things that should be there. In the cardiac cycle, another important repeatedly asked question is heart sounds. Okay, I think all of you know what is the basis of first heart sound, second heart sound. Now I would like to ask one question. How will you identify a first heart sound clinically? Please try to understand my question. Whenever you are examining the patient with the auscultation, how will you identify first heart sound? Anybody?
మ్యామ్ ఫస్ట్ హార్ట్ సౌండ్ కెరోటిడ్ పల్స్ తో కోఆర్డినేట్ అవుతుంది, ఐ మీన్ సింక్ అవుతుంది అని చెప్పారు.
Very good, very good. Do you want to check the carotid pulse with the index finger and middle finger or thumb?
అన్నారు మ్యామ్.
Amma?
థంబ్ అన్నారు మ్యామ్.
Very good, very good. So whenever you are examining the right carotid, try to use left thumb, and left carotid, right thumb, as well as never ever examine both the carotids simultaneously. Very good. Okay, heart sounds. In which heart sound you are going to observe the physiological split?
S2 అన్నారు మ్యామ్.
S2. Very good. So now we will move on to the another topic, that is conducting system. Okay, I think all of you know what are the components of conducting system, and which one, why SVA node is called as pacemaker. Anybody?
రేట్ ఆఫ్ ఇంపల్స్ జనరేషన్ హార్ట్ రేట్ కి ఈక్వల్ అన్నట్టు చెప్తున్నారు మ్యామ్.
Very good, right. Highest rate of impulse generation occurs, and it is going to cause suppression of all other parts of the conducting system. Please, all of you make a note. If you don't have an idea, make a note of the term overdrive suppression. Overdrive suppression of all other components. So in the conducting system of the heart, SA node, AV node, bundle of phase, Purkinje fibers, of course, right and left bundle branches, all are having the capacity to generate impulses, but highest rate of impulse generation is happening at the SA node, and because of that, it is suppressing rest of the things. That is called as overdrive suppression. This word is very important. And one more thing is, what is the most important event happening at the AV node in the conduction? During the conduction, what is the most important thing happening at the AV node? Anybody? AV node దగ్గర జరిగే ఈవెంట్
నోడల్ డిలే అని చెప్పారు మ్యామ్.
Very good. How much of time? What is the duration? Another associated question is why?
0.01 సెకండ్ అని చెప్పారు మ్యామ్.
It is 0.1 second, ma.
ఓకే.
0.1 second. Okay. Tell me, what is its why it is slow? What is the reason?
ఫిల్లింగ్ ని పర్మిట్ చేయడానికి అని చెప్తున్నారు మ్యామ్. వెంట్రికులర్ ఫిల్లింగ్.
Wait. That is the purpose of AV nodal delay. How it is happening, why the delay is happening means, please all of you make a note, that is the fibers here are smaller in diameter and fewer gap junctions. Gap junctions are less in the AV node, and the fibers are also very delicate and where the conduction is less. Okay, of course, it ensures efficient cardiac pumping because this particular AV nodal delay facilitates the ventricular filling. Okay. Now we will move on to another question. Why do the ventricles contract from the apex towards the base? I think all of you know what is apex and what is base. From apex to base, ventricles contract. Why it happens so? That is because of the arrangement of the, once again, one of the component of conducting system.
Purkinje fiber arrangement and chaptunar ma'am.
Very good. From Purkinje fibers first innervate this apical region, and from there the movement of the depolarization occurs towards the base. And what is the purpose of it? Just if you, I would like to give an example regarding this one. So whenever there is a paste is going to be completed in your, at the end of the tube, what is that you are going to do? Always you have to squeeze from below upwards, isn't it? That is the same. So effective pumping happens because of this particular type of contraction. Okay, I think everybody can answer this one. If the heart is going to be removed and kept in a proper conditions where you are going to supply oxygen and nourishment, in such cases, heart beats continuously. What is this phenomena is due to? What is the property? Which property explains? Hello, DS, are you there?
Ma'am, automaticity antunar ma'am.
Very good, automaticity. Okay, now you tell me what is normal heart rate?
60 to 100 antunar ma'am.
Very good, 60 to 100 per minute. Okay. What is intrinsic heart rate? This is one of the important Viva OC question. What is intrinsic heart rate? Anybody?
Ma'am, SA node, sorry ma'am, I'll read it. SA node impulse generation rate and chaptunar ma'am.
Intrinsic heart rate means whenever if you are going to denervate the heart, in such cases, whatever the heart rate is going to be recorded, that is called intrinsic heart rate. So, as you told, 60 to 100 is the normal range of heartbeat. Is it under the influence of the autonomic nervous system, or it is not under the influence of autonomic nervous system? Anybody? Under the influence or not under the influence of autonomic?
Not under the influence and chepparu ma'am.
Oh my God, no. It is absolutely under the influence of autonomic nervous system. So in the normal human body, there is, I think all of you know the nerve supply of the heart. Vagus nerve is going to be supplied and sympathetic innervation is also there. And so here what is going to happen is your normal heart rate is a result of vagal tone. It is especially under the influence of vagus. It suppresses. Okay. So all of you know that whenever there is sympathetic stimulation is there, it increases the heart rate. Whenever there is vagal stimulation is there, it decreases the heart rate. Okay. But in the normal condition, both of them are working and it is absolutely under the vagal tone. Means the parasympathetic system is little more effective for the normal heart rate of 60 to 100 beats to be there in the normal range. For it, now you tell me if this vagus is removed, what is going to happen? Of course, automatically the suppression effect is going to be lost. Heart rate is going to be increased. That anybody can understand. But in the case of transplanted heart, what is going to happen? One heart is going to be completely removed and from one body, and it is going to be relocated or transplanted to the another one. In such cases, denervation occurs. In the denervation conditions, denervated conditions, you are going to see increase in heart rate, and that is called as intrinsic heart rate, denervated heart rate. In the normal body, of course, autonomic nervous system is the one which undergoes vagal tone effect will be there. Okay, coming to the one of the another example, that is applied condition or clinical condition where you can see intrinsic heart rate, but in the case of physiological conditions, that is fetal heart rate. Fetal heart rate where there is no blood supply, sorry, that is innervation is not yet formed. In such cases, if you attend any of the clinics, the OBG clinics, you can see that is 140, 150 is the normal fetal heart rate, because it is, that is nothing but intrinsic heart rate. Okay. Is it clear?
Yes, ma'am.
Okay, among all these conducting components of the heart, conducting system components, which one conducts it the fastest? And how much it is?
Ma'am, Purkinje fibers antunar, ma'am.
How much, Emma? Very good. Right answer. 4 meters per second. 4 meters per second. That is the correct answer. We will move on to the another applied aspect. All of you, please try to pay attention to my question. Why do trained athletes have resting sinus bradycardia without symptoms? Athletes low 40, 50, 60, maybe the normal heart rate. Is it okay to have such a lower heart rates? So cardiac output should be around 5 liters per minute. And this is absolutely required for normal functioning, normal tissue supply of oxygen and everything. So here, in the case of bradycardia, resting bradycardia, that is normally the heart rate will be at the lower levels, 50 or 60 maybe there per minute. In such cases, what compensates for it and why athletes? Anybody know about this one? Shall I explain?
Response అయితే ఏం రాలేదు ma'am students.
Okay, ma'am. Okay, ma'am. So please try to understand, trained athletes will have sinus bradycardia, resting sinus bradycardia. All of you, please try to make a note of it. Trained athletes do have resting sinus bradycardia and usually without any symptoms. What is the reason means? Athletes, because of this training process, just now we discussed, normal heart rate is under the influence of both sympathetic and parasympathetic, and parasympathetic being at a higher level of influence, and that's why you are calling it as vagal tone. Vagal tone. Normal heart rate is a function of vagal tone. Okay, normal heart rate is a function of vagal tone. Okay, because of this training process, this excessive stimulation of vagal tone is going to be increased. That's why it is going to be decreased. But all of you know that cardiac output is a product of cardiac output, heart rate and stroke volume. When the heart rate decreases, cardiac output decreases. When the cardiac output decreases, tissue perfusion decreases, and then you should get so many issues and problems. But that is not the case here, because there is a compensatory mechanism, that is stroke volume is going to be increased rather than heart rate in the case of trained athlete. And this is the one of the best cardiac adaptation of the athletes. Is it clear, Amma? Shall I explain again?
Okay అంటున్నారు ma'am.
Okay, ma'am, that's good. Okay, one clinical case for you. A 68-year-old man presents with recurrent episodes of dizziness and brief loss of consciousness. His pulse is 34 beats per minute and regular. ECG shows complete dissociation between P and QRS complexes, indicating that atrial impulses are not reaching the ventricle. What is the diagnosis? మళ్ళీ ఇంకోసారి చదువుతాను. A 68 8-year-old man presents with recurrent episodes of dizziness and brief loss of consciousness. Pulse rate is 34 beats per minute. That is bradycardia, sinus bradycardia, and is regular. ECG shows complete dissociation between P waves and QRS. This is one of the most important clue for your diagnosis. Complete dissociation between P waves and QRS complexes. Also, he tells that indicating that atrial impulses are not reaching the ventricles. What is the diagnosis?
Complete heart block antunar, ma'am.
Amma?
Complete heart block antunar,
Very
ma'am.
good. Complete or third degree heart block. What is idioventricular rhythm and what is its rate? Anybody?
Ma'am, AV node intrinsic ga, I mean SA node lenappudu AV node produce chese rhythm ani cheptunnaru ma'am, and 15 antunnaru ma'am.
20 to 40 beats. 20 to 40 beats. And in this case, what is the treatment suggested is artificial pacemaker, because pacemaker is it's defective. So artificial pacemaker has to be okay. Okay, this is about the conducting system. We will move on to the another topic, erythropoiesis and factors affecting it. I know this picture is not so impressive for you, but I think I can make out. So here, the most important thing an examiner expects from you is how the different phases are transforming from one phase to another phase. So here, what is going to happen to the nucleus? What is going to happen to the hemoglobin content, staining, and of course, what is this one? Mitosis levels. So as the different stages of erythropoiesis is happening, that is the stem cell to that of the reticulocyte and mature RBC, the size of the RBC is going on decreasing and nuclear pattern is going to be decreasing. Almost it is going to be clear there is no nucleus in the RBC. Anybody can tell what is the reason why there is no nucleus in the RBC? And if there is no nucleus, how can you say it is a living cell? These are the two questions. Why it is not there? Because it is enucleated, can we say it is a dead cell? Anybody?
Ma'am, no response, ma'am.
Okay, basically, the RBC is the very function of RBC is to supply oxygen. Okay, I'll give one example so that you can easily understand. A mother's responsibility is to feed the kids, isn't it? If the food is very less, in such cases, what she will do? She won't eat, but she will distribute whatever she has to all the kids, isn't it? In the similar way, if the nucleus is there, the metabolic rate is going to be much more and it has to use much more amount of oxygen which is going to be carried by it, but that is not going to be useful for the tissues of the body. What does it do is it sacrifices its own nucleus. And how can we say it is a living cell then? So because anaerobic mechanisms, Embden-Meyerhof pathway, this is the different mechanisms it will adopt for the all metabolic activities. That's why it is a living cell. Metabolism is happening. So that's why you can say it is a living cell. And another one is why there is no, because to reduce it oxygen supply towards its own metabolism, it is decreasing or eliminating its own nucleus. Okay. Okay. So here, what are all the things you have to understand is the pH status is going on decreasing. It is becoming from basophilic to acidophilic. Okay. So, and the hemoglobin level is going to be first appears in the intermediate normoblast or polychromatic normoblast. Intermediate normoblast or polychromatic normoblast. Okay. Okay. Please, all of you must and should know these, able to draw these particular diagrams, and as well as all the different phases and the description also must and should know. And whenever this erythropoiesis is asked as a question, we expect these two diagrams, that is a tabular column as well as diagrams, okay, with the proper staining material you are using. Eosinophilic hematoxylin stains, where to use, you should know very clearly. Okay. So whenever you asked, when you are asked about this particular question, first of all, you have to describe what is erythropoiesis, of course, production of RBCs, and what are the different stages, that is mesoblastic, hepatic, and this bone stage you have to write. And afterwards, now you tell me, in any adult, do you think hepatic stage is going to be again regained? Hepatic stage is going to be activated? Anybody?
మ్యామ్ ఎక్స్ట్రా మెడిల్లరీ హెమటోపాయిసిస్ థాలసీమియా వాటిలో వస్తాయని చెప్తున్నారు మ్యామ్.
Very good, very good. And okay. Right. Just a minute. Okay. So some of the questions regarding erythropoiesis. Why do people living at high altitude have an increased red blood cell count?
మ్యామ్ అక్లిమటైజేషన్ టు హైపాక్సియా అని చెప్తున్నారు మ్యామ్.
Okay, hypoxia. How do this hypoxia stimulates this particular erythropoiesis? What is the connect?
ఎరిథ్రోపాయిటిన్స్ ఇంక్రీస్డ్ ఎరిథ్రోపాయిటిన్ రిలీజ్ అంటున్నారు మ్యామ్.
Very good. So chronic kidney diseases, usually they suffer because suffer anemia, okay, because of lack of this particular erythropoietin. What is the morphology of RBCs in iron deficiency anemia? Anybody?
మైక్రోసైటిక్ హైపోక్రోమిక్ అంటున్నారు మ్యామ్.
Very good, very good. What is erythroid myeloid ratio? RBC WBC ratio, please tell.
నో రెస్పాన్స్ మ్యామ్. మ్యామ్ 700:1 అని ఒకటి చెప్పారు మ్యామ్.
Correct. Right answer. 600 to 700 RBCs for 1 WBC. What is erythroid myeloid ratio, ma?
మ్యామ్ 2 to 4:1 అని చెప్పారు మ్యామ్.
అంటే erythrocytes are 2 to 4 for 1 WBC.
యా మ్యామ్ అలా చెప్పారు మ్యామ్. నో మ్యామ్ రివర్స్ చెప్పారు మ్యామ్, సారీ.
Yes. Okay. Good. Correct answer. That is in the stem cells or precursor cells, the WBCs are more in number than that of the RBCs. Anybody can tell what is the reason for this one?
నో రెస్పాన్స్ మ్యామ్.
So when you take the duration of lifespan of RBC, it is about 120 days, whereas in the case of maximum is that is 12 days in the case of WBCs. So that's why more and more production of WBCs should occur. That's why the myeloids are more than that of the erythroids in the bone marrow. Okay. Okay, here I would like to read one case scenario. Please, all of you pay attention. A 55-year-old man with a history of chronic kidney disease presents with progressive fatigue, weakness, reduced exercise tolerance. On examination, he appears pale. Laboratory investigations show that is 8.2 grams per deciliter, that is hemoglobin, whereas RBC count is 3.5 million per cubic millimeter. Serum iron being normal. Vitamin B12 is normal. Serum creatinine is markedly elevated. And what is the reason for this particular anemia in this particular chronic? Anybody? Already big clue is given in the clinical scenario, that is 55-year-old man with the history of chronic kidney disease. So because of reduced erythropoietin in the chronic kidney disease. What type of anemia is commonly seen in this particular chronic kidney disease?
Microcytic hypochromic antunnarru.
See, here erythropoietin is deficient. And in the case itself, it is given that is iron content is normal. So there is no iron deficiency. Normocytic normochromic anemia. Anybody can tell what is the other example for normochromic normocytic anemia?
Hemorrhage annaru ma'am.
Good, right answer. Okay, what is the treatment, Ma, in this case? Recombinant erythropoietin is given, that is, of course, which is going to establish once again this particular erythropoiesis. Okay. From your side, any doubts, anything you want to ask, please.
Ma'am, ఏం డౌట్స్ అయితే ఇప్పటికీ అడగలేదు మ్యామ్.
Okay, ma. Okay, one thing I want to tell all of you is how much you know is different from how much you present. Please, all of you, provide a structured answer. Try to give, for example, erythropoiesis is asked. Directly don't jump into the phases of erythropoiesis, but you write about the definition and what are all the stages where mesoplastic and hepatic and all those things. Then you move on to this particular thing and applied aspects. Whenever there are applied aspects, try to mention them. And diagrams, flow charts, tabular columns speaks a lot about your knowledge and your coherence towards the subject. Okay, so that's why your presentation matters now. Be cool whenever you are answering whenever you are learning one particular question. Please, you ask yourself, if this question is asked, how I would like to present. Just make a mind map of it and try to present. All the very best. Hope my session added some insights to you and have some clarity towards the subjects we discussed, topics we discussed. Okay, ma. Thank you, Ananda.
థ్యాంక్ యూ మ్యామ్. మ్యామ్ ఒక్క డౌట్ అడిగారు మ్యామ్ ఇప్పుడే. ఇంట్రెన్సిక్ హార్ట్ రేట్ ఏ పెథలాజికల్ కండిషన్స్ లో చూస్తామని అడిగారు మ్యామ్.
ఎకనామిక్ డిస్ఫంక్షన్ అనుకోవచ్చు, కానీ యాజ్ ఆఫ్ ఇది నేను చెప్తున్న ఆన్సర్. దెర్ ఈస్ నో, ఐ నెవర్ సీన్ ఎనీ టెక్స్ట్ బుక్ అబౌట్ దట్ పర్టికులర్ థింగ్. Basically, transplanted heart and fetal heart rate is considered as intrinsic heart rates. Okay.
Yeah, ma'am. Thank you, ma'am. We extend our heartfelt gratitude to Dr. Sarvani, ma'am, for such an insightful and enriching session. Thank you, ma'am, for your valuable time, guidance, and unwavering support. Let us end this session with Shanti Mantram. Om Sarve Bhavantu Sukhinah, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu, Ma Kaschid Dukkha Bhave. Om Shanti, Shanti, Shanti. Thank you, everyone. Thank you so much, ma'am.
Thank you, ma. Bye.